Hi, my name is Jillian Geiger, and today I'm going to be obtaining a sterile urine sample from a Foley catheter. So 15 to 30 minutes ago, I did enter my patient's room and clamp the catheter so that way all the urine in the urine sample would be fresh and not contaminated, because once it reaches the bag, it is contaminated. So I have clamped the Foley, and I also have verified my patient's name and date of birth, level of consciousness, pain, and she's currently not in any pain, and I have reintroduced myself. So now I'm going to take my mock sterile field. I have already performed a hand hygiene upon entering, but I'm going to perform hand hygiene again. I'm going to take my sterile field, open away from me, with all the sides. And I'm going to grab my sterile gloves that I have put in here. Make sure you can see me opening up my sterile gloves, and I'm going to grab it by the cuff, put it in, grab it underneath the cuff. Alright, and now if there were any adjustments to be made, I would make that. Typically I would not touch my sterile glove package again, but I'm going to move it out the way for the purposes of this demonstration. And now I'm going to take one of the alcohol wipes that are in my sterile field, open it up, and clean the site that I will be getting my urine sample from, just like so. And then I will discard that. Then I'm going to take a 10 milliliter syringe, insert it into the port, and draw out the 10 milliliters of urine. Okay, and I'm going to detach it. And I'm going to take my sterile specimen container, uncap that, and put the urine sample in here. Then I would discard of this syringe, recap the sterile urine sample container, and then I would put a label on it with who got the sample, who the sample's from, what the sample's for, date and time. And I would send this off to the lab in Lexington. And then I would just make sure to clean the site one more time, just so there's no like residual, and I will make sure that I unclamp the Foley catheter line, so that way all the urine is now going to be flowing back into the bag. And then I'm going to just resituate my patient, making sure that it's clamped, the Foley's clamped on the bed, making sure there's nothing that she needs. I would remove my gloves before I touched her sheet. And I will come back to check on her.